In the realm of healthcare, the clarity of communication can be the difference between uncertainty and insight, especially when it comes to electrocardiogram or ECG findings. For medical professionals, presenting these findings to colleagues requires a structured approach. Start with a clear format, including patient demographics, clinical history, and the reason for the ECG. Then proceed in chronological order, from basic parameters like heart rate and rhythm to specific abnormalities. When interpreting the ECG, opt for objective language, steering clear of jargon, and highlight clinically relevant findings that could influence patient management. It's crucial to correlate these findings with the patient's symptoms and clinical presentation, offering a comprehensive clinical picture. Risk stratification and prognosis should also be discussed, if applicable. Recommendations for follow-up actions should be explicit, with the urgency of further evaluation or intervention clearly indicated. Collaboration is key. Encourage input on challenging cases to enhance patient care. And remember, thorough documentation in the patient's medical records is essential for continuity of care. Turning to the patient side of the equation, the art of communication takes on a different hue. It's about demystifying the ECG by using plain language and visual aids to make the information digestible. Connect the dots between the ECG findings and the patient's symptoms, helping them understand the relevance of the test. Treatment options should be discussed, explaining how the ECG results may influence medication, lifestyle changes, or other interventions. Risk assessment is also part of the conversation, addressing potential future cardiac events and the importance of monitoring. In the spirit of patient-centered care, involve patients in the decision-making process. Lay out the pros and cons of different management options, taking into account their preferences and values. Clearly outline the next steps, whether that involves more tests, specialist consultations, or ongoing monitoring, and encourage them to voice questions and concerns. To cap it off, provide written summaries or educational materials for patients to take home. This not only reinforces the discussion, but also ensures that they retain the crucial information shared. In conclusion, whether communicating with colleagues or patients, the guidelines for conveying ECG findings are anchored in clarity, relevance, and collaboration. By adhering to these principles, healthcare providers can foster a deeper understanding, facilitate shared decision-making, and ultimately enhance the quality of patient care.